All right, Chapter 25, Immune System Disorders. Um, this involves, of course, conditions that either depress the immune system or cause illness. And illness is caused by pathogenic agents. They can be prions. Prions are infectious agents composed only of proteins. They can affect the structure of your brain and your nervous tissue. They can be transmissible spongiforms, causing encephalopathies. And encephalopathies is a word for, encephalid refers to the head. So pathologies that occur in the head. And they're impossible to cure. An example of a prion would be mad cow's disease. That's a disease that's caused by a prion. Viruses also cause disease, and viruses, they're genetic material. They have DNA and RNA. They replicate like normal cells do. But what a typical virus does is it has to use the machinery of the other organism's cells in order to reproduce. So viruses have a tendency to attach to living cells and then make their way into the living cell and use the cell's own machinery, if you will, in order to reproduce. So viruses need a host in order to live. Some viruses are more virile than others. As a good example, the AIDS virus is not a very potent virus at all. It lives only a couple hours outside the body, where the hepatitis B virus can live up to 7 or 10 days in dried blood. Viruses are treated with antiviral medications. With many viral infections, there usually isn't a cure. Usually end up just treating the symptoms. But there are some antivirals that may certainly help your own immune system eradicate the virus. Quite a few different viruses that can attack different parts of our body. If we look at the head, they have the JC virus, measles, the LCM virus, arborovirus, rabies, all cause encephalitis or meningitis. And then you get into just the common colds. You got rhinoviruses, parainfluenza viruses, RSV, which is the respiratory syncytial virus. Pharyngitis can be caused by the adenovirus, the Epstein-Barr virus. Cardiovascular system can be affected by the Coxsackie-B virus. Of course, the liver can be affected by any of the hepatitis, A, B, C, D, or E. Your skin can be attacked by multiple viruses to include varicella zoster, human herpes virus, smallpox, papilloma viruses, rubella, measles. Sexually transmitted diseases like herpes certainly can affect the genitals or the reproductive organs in both men and females. Eye infections can be caused by the herpes simplex virus. Pneumonia can be caused by influenza A or B, parainfluenza, RSV, adenovirus, SARS, coronavirus. All of those different viruses can affect different parts of your system. Bacterias are called prokaryotes, and they have a less sophisticated nucleoid and organelles when compared to regular cells. Some bacteria do have flagella, and flagella are the little hair-like extensions on the cell that permit movement, so they can move around in liquid medium. They're classified by their shape as either cocci, bacilli, or spirochetes. They're also classified by their arrangement: diplococci, streptococci, staphylococci, different arrangements of the viruses. And then they're either Gram-stain negative or Gram-stain positive. And Gram-stain is under a microscope, they take fluid and they stain it with a a purple liquid, and the viruses may take up the gram stain, and when they do, they're very easily to detect, or they don't pick up the gram stain. Bacteria are killed with antibacterials. They help kill and limit the bacteria growth, and it just requires the physician to determine what is the best antibacterial for that particular type of bacteria. We start with something like a really broad spectrum antibiotic like Rocephin is an example, and then depending on the cause or the type of bacteria, they may change the antibiotic to one that's designed specifically for that bacteria. Bacterial infections include bacterial meningitis, and those are the bacteria that cause it. Otitis media, which is inner infection. Pneumonia can be caused by bacteria as well. Skin infections can be caused by bacteria. Sexually transmitted disease like chlamydia, gonorrhea, those are all bacterial infections. Eye infections like Staphylococcus aureus, gonorrhea, chlamydia, sinusitis could be caused by a Streptococcus pneumoniae or Haemophilus influenza. The upper respiratory tract can be affected by Streptococcus pyogenes or Haemophilus influenza. The gastritis, if you think about Helicobacter pylori, that's a bacteria that causes ulcers. And for many people who have ulcers, we often think, well, we've got to take something to shut the acid pumps down, or we have to take something like a Prilosec or some sort of H2 blocker so that the ulcers have time to heal, when in fact the ulcers aren't being caused by acid at all. The ulcers are being caused by a bacteria. And if you treat the patient with antibiotics, their ulcers in their stomach get better. Food poisoning can be caused by a bacteria, particularly like Salmonella, Shigella, Clostridium, Staphylococcus aureus, are all intestinal infections from bacteria. Urinary tract infection caused by bacteria as well. So bacteria can cause infections, and of course, whenever your body is breached by these bacteria, and the bacteria get into your system, if your immune system is healthy, they may certainly kill these bacteria, preventing them from multiplying. If your immune system is suppressed, they'll cause these infections and illnesses in your body. Some pathogenic agents also include parasites. Parasites live in or on another organism, and they use the organism to survive without contributing to the host's survival. They include things like worms and protozoa, so things like hookworms, ticks, liver flukes, bed bugs, tapeworms, lice, leeches, fleas, giardia, mosquitoes are all considered parasites. Fungi is certainly another type of pathogen that can affect the immune system. And those are protists, or plant-like organisms that do not contain chlorophyll. They include yeasts and molds, and they're treated with antifungal medications. Certain people may develop a fungal infection of the lungs after breathing in spores from black mold, breathing in spores from untreated mulch, breathing in spores from cleaning up mice or bat dung. And when they get this antifungal infection in their lungs, it's extremely difficult to get rid of. Presents a lot like pneumonia, maybe even cancer because of the spots on the lungs. But on biopsy and subsequent tests, it's determined that it's just fungus that's in there. And the antifungals are really hard on the system. They have to be taken for a long period of time before they see any success from that sort of infection. Your body has ways to prevent these bacterias and viruses and funguses and parasites from getting into your system and causing illness. Certainly your skin is designed to protect your body as long as there's no breaks in the skin. But as you know, like ticks and mosquitoes and leeches and those sort of things can latch onto the skin and eventually penetrate the skin and may cause illness, as in the case of a deer tick causing Lyme's disease. You have stomach acid that kills a lot of these invading organisms once they're in the stomach, but if they come in large enough numbers, you may have some trouble killing these invading organisms with your stomach acid, and in those particular cases, you may try to remove them, as in the case of a urinary tract infection, where you urinate a lot, or as is the case with diarrhea. Diarrhea, although inconvenient, is quite a effective protective mechanism when you particularly consume too much bacteria. With your upper respiratory tract, you've got the mucous membranes in the nose. So as you breathe air in through your nose, you not only warm and humidify it, but you also filter it. As the bacteria and these viruses and things get into your respiratory tract, certainly sneezing helps propel that stuff out. Your ciliary and your bronchioles and the mucus being pushed up so that you can cough it out is another defense mechanism as well. So some other host defenses include tears, that has a cleansing action to the eye, mucus, which is a barrier to contact of organisms and cell surfaces. Defensins are antibacterial peptides that are produced by epithelial cells of the intestine, and they help control colonization, and that's the reproduction of lots of bacteria. They can prevent the bacteria from setting up a colony in your GI tract. Certainly that's a good thing. Intestinal peristalsis, that's what propels the microorganisms that do not have a mechanism for colonizing into the small bowel and then into the large bowel and then out. Your ciliated epithelium, or the little hair-like things that moves the stuff up so that you can cough it out. Gastric acid certainly is very lethal to microorganisms. And then microbial flora. It's present on the skin. It's in mucous membranes. It's also in the GI tract that again help fight invading bacteria. And then the intact skin, the skin being a very effective barrier to microbial invasion. This was just a slide illustrating the normal flora of the GI tract. And there is normal lactobacilli, normal lactostreptococci, normal enterobacteria in different parts of the small bowel as well as the large bowel. So we need a certain amount of bacteria in our GI tract. That's normal. It needs to be there. Typically when those amounts of bacteria become quite large, that's where we might see some diarrhea. Certainly the odor of your feces is directly related to the bacteria count. The more bacteria you have in your stool, the fouler it smells. As far as some internal defenses, you have what's called natural immunity. And natural immunity is an inflammatory response and the release of mediators. The triggers can be infection or injury that causes swelling or destruction at a cellular level. Arterioles, venules, capillaries dilate to push blood to the area producing the edema. And then various agents and different systems within your body fight off the infection. In addition to fighting off the infection, they have to clear and eliminate the destroyed tissue. Those agents, and certainly systems is your white blood cells, but those agents include granulocytes, neutrophils, eosinophils, and basophils. And these white cells, the neutrophils, eosinophils, and basophils, they're present in the blood in different amounts at different times of the infection. So when they look at a complete white count and they want to know, how many neutrophils do you see, how many eosinophils, how many basophils, that helps the provider know whether at what point in the infection they're at. Your lymphatic system, lymph flows away from the body tissue towards the heart, and it removes debris and pathogens from tissue. It passes through the lymph nodes, and the lymph nodes filter out the foreign materials. They collect infection-fighting cells that help kill pathogens on the way to the heart, and those are called lymphocytes. Lymphatic drainage eventually feeds into the central veins, entering the heart through the right and left thoracic duct. A condition known as lymphadenopathy, you can see in this particular picture a person who's got swollen lymph nodes. So the lymph nodes have become plugged and swollen, and you can see those in that particular picture. The lymph nodes are located throughout your body. You've got cervical nodes along the course of the internal jugular. You've got pericranial ring at the base of the head. You've got tracheal nodes in the trachea and the bronchi. You've got axillary nodes under both arms. You've got deep nodes related to the aorta and the celiac trunk and the superior and inferior mesenteric arteries. And then you have your inguinal nodes that align your inguinal ligament, as well as your femoral nodes that travel along the femoral vein. And again, as it was mentioned, the lymph node receives lymph vessels carrying lymph into the lymph node, and the lymph node filters the blood of harmful stuff as it makes its way back to the heart. So the blood circulating out of the heart to the tissue has been filtered by the lymph nodes. So lymph nodes, filter the blood, much like the kidneys, much like the liver. So multiple levels of filtering occur, with the lymphatic system being the most important to your immune system. Acquired or active immunity is the physiology of antigens and immune response. And acquired immunity occurs when your body recognizes a foreign substance, which we'll call an antigen. And when the body sees that foreign substance or that antigen, it mounts an inflammatory response. So things like histamine, bradykinin, leukotrienes, all these things are released into your bloodstream, and they go to work building antibodies, so that should they see the antigen again, those antibodies are there to help fight and destroy that antigen. Humoral immunity occurs with the B lymphocytes producing the antibodies that destroy bacteria. It kills the bacteria freely moving in body's tissue and fluids. And it also triggers mast cell to help mast cell release, which mast cells release histamine and bradykinin. So mast cells release those those inflammatory chemicals like histamine and bradykinin and those sort of things. You can have cell-mediated immunity, and that's where T lymphocytes lyse the body cell to kill the indwelling pathogen. And with T lymphocytes, they activate macrophages. Macrophages kill the pathogen by consuming it. So here's an example of humoral and cell-mediated immunity. With humoral immunity, you have B lymphocytes that consume the whatever those are, the extracellular microbes, the bacteria. You have B lymphocytes that consume the bacteria through a process known as phagocytosis. These macrophages consume that and destruct it. With cellular immunity, you've got the intracellular viruses and the T helper cells attached to the antigen cell and lyse the infected cell. So humoral immunity is the consumption of the bacteria by B lymphocytes, and cellular immunity is inside the cell. The virus is inside the cell, where with humoral immunity, the virus or the microbe is in the blood floating around. Okay? So, this kind of gives you an example of the different types of immunity that your body has. You have lymphatic or adaptive immunity. You have innate or bone marrow immunity. So bone marrow and lymph nodes and lymph tissue and lymphatic tissue and the bone marrow are your first line of immunity. Within adaptive immunity, you have natural immunity, which you get from your mother. So as a developing fetus, should your mother be exposed to certain infections, bacteria, viruses, whatever, when she builds the antibodies, the fetus gets those as well. And then there's also active adaptive immunity, where you get the infection and your body builds the antibodies. And then there's artificial adaptive immunity. Artificial adaptive immunity includes things like immunizations, where we're not going to wait around to get the disease. We'll just inject you with a little small amount of the disease so that your body's own natural immune system can develop the antibodies. So the phases of an immune response. The cognitive phase, the antigens bind to specific receptors on the lymphocytes unique to that antigen. The activation stage, the lymphocytes specific to the antigen copy themselves and convert from antigen-recognizing cells to antibody-secreting cells. And then they migrate to the antigen or the inflammatory site. And then the effector phase is when they trigger a more enhanced and focused response in cells involved in the natural immunity. So there's different phases of the immune response that lead up to the development of antibodies and then the subsequent release of antibodies when an antigen or a poison enters the body. Some factors affecting the immune system, certainly skin. If your skin is broke down, if you have any open wounds, those sort of things, that will allow viruses, bacteria, and those sort of things to get into the body. If you're not wearing proper PPE, we all know about the potential for bloodborne pathogens and why it's so important to wear proper PPE. And of course, exposure prevention that goes hand in hand with not wearing proper PPE, but then also the potential for things like needle sticks. The internal defenses, well, we talked briefly in that visual of the types of immunity that we have. With passive immunity, those are more things like immune globulins in your body. You have lots of different types of immune globulins that are part of your immune system. As an example, IgEA, IgEB, IgEE. Some of these different immune globulins are more prevalent in your bloodstream than others, depending on the type of infection that you're dealing with. Rabies and tetanus certainly are an example of some infectious diseases that, if we don't receive proper immunization for tetanus, we may not have the antibodies to fight that off should it be present in our system. And we don't have, prophylactic rabies immunizations that we can give. It's just after exposure to rabies, there's a set of shots that need to occur to protect you from getting rabies. Because the other thing to keep in mind about rabies and tetanus, once you get the diseases, neither one is curable. So if you actually come down with rabies because you didn't do the set of rabies shots, you're going to die from your rabies because it's not curable. Once you come down with true tetanus because you didn't get your tetanus shot, you're going to die from that because there is no cure. Active immunity, that's where you're exposed to either a synthetic dead or a modified pathogen or germ in a sub-infectious amount. So active immunity is, we're going to take the active process of giving you a little bit of the antigen so that you develop antibodies and don't get sick when you're actually exposed to the full amount of antigens. So vaccinations would be a good example of active immunity. Some, acquired immunodeficiency refers to HIV and AIDS. HIV is the human immunodeficiency virus, and AIDS is acquired immune deficiency syndrome. HIV and AIDS targets the T lymphocytes with surface marker CD4. AIDS is always caused by HIV, but HIV doesn't always cause AIDS. There are people out there that carry the human immunodeficiency virus, but never come down with the actual disease, acquired immune deficiency syndrome. Magic Johnson would be an example of that. He has the HIV virus, but he's never gotten the disease. The CDC classifies the presence of the human immunodeficiency virus by your CD4 count. See risk factors associated with getting HIV and AIDS. Certainly blood, semen, vaginal, cervical secretions may harbor the virus. Vaginal, anal intercourse may increase your risk of exposure to the virus. The fetal placenta, open mucous membranes and wounds. If blood tainted with the HIV virus comes in contact with those open mucous membranes or wounds, there's a potential for infection. IV drug abusers, because they're sharing needles. Heterosexual, homosexual, bisexual activity. So, it's not as often depicted or believed a homosexual activity that causes HIV or AIDS. Certainly if a heterosexual IV drug abuser gets AIDS from sharing, gets HIV from sharing needles, certainly could affect their heterosexual partner. Blood transfusions before 1985 led to HIV, and that's certainly, I think, how Magic Johnson said that he got it, how Winona Judd said she got it. by having blood transfusions prior to them actually screening for the HIV virus. Prenatal, perinatal, postnatal, neonatal transmission can occur as well. And then, of course, if you're not wearing your proper personal protective equipment, you could get a significant exposure. So that's why it's so important to follow your exposure control plan. In evaluating for the potential of HIV and AIDS, if a history shows that the patient has HIV, or they relay to you that they have HIV, it's certainly important to ask if they've ever been diagnosed with the acquired immune deficiency syndrome. Not only patient and family, but I think just as a general rule, people need to understand that there is a difference between HIV and a difference between AIDS. Certainly the difference being HIV is the virus and AIDS is the disease. And because I have the virus doesn't mean I'll get the disease. I may be one of those that never seroconverts. So there could be people out there that carry not only hepatitis and AIDS and other bloodborne pathogen viruses, but they never ever get the diseases. So that's why it is so vitally important to wear personal protective equipment around blood and body fluids, because you just don't know who has the virus and who doesn't. Obviously, if they're sick with the disease, you know it. But as we just mentioned, you don't have to be sick with the disease to carry the virus. It's important to educate people about how AIDS is transmitted. It's not transmitted through a handshake. It's not transmitted through a normal kiss on the cheek or lip. It's not transmitted by, sharing a fork, drinking out of the same cup of water. Those typically aren't ways that the HIV virus is shared. And then prevention, certainly safe sex practices, not sharing needles, things to prevent the virus from getting into your body, wearing proper personal protective equipment whenever around blood or body fluids. Lymphoma is cancerous. It affects the B and T lymphocytes and stem cells, and lymphoma manifests itself in the lymph nodes. You get the lymphedema as a result of lymphomas, and of course by affecting the B and T lymphocytes, you don't have the lymph cells necessary to attack and fight viruses and bacteria that get into the blood. Leukemia is a cancer disorder of the blood cells, and leukemia is a very low white count is how leukemia is diagnosed, with a very, very, very low white count. And of course, if you have a very low white count, then your body's opening up for all sorts of type of infections, because you just don't have the ability to fight that stuff off with a low white count. The autoimmune disorders occur, they're not really sure why, but what they mean by an autoimmune disorder is your body attacks itself. A good example of that would be diabetes. They're not sure why the diabetes in the diabetic patient, the type 1 diabetic patient who has a destruction of the B cells in the pancreas, they're not sure why the beta cells of the pancreas are destroyed by the body, which causes type 1 diabetes. So diabetes is an autoimmune disorder. Lupus is an autoimmune disorder. Rheumatoid arthritis is an autoimmune disorder. Multiple sclerosis, celiac disease, chronic active hepatitis. Those are all autoimmune disorders. Some can be identified as perhaps an initial bacteria or virus starts it, like in the case of active hepatitis, but in others they're just not sure why those disorders occur. Hypersensitivity disorders include type 1 or immediate hypersensitivity disorders. That's where you get the allergic reaction. It's caused by the release of histamines and bradykinin and leukotrienes. You get the hives, you get itchy skin, watery eyes, runny nose, and certainly if it's overly exaggerated, it can lead to anaphylaxis, which is a form of shock. An anaphylactoid reaction is a anaphylaxis-like reaction from perhaps some type of hypersensitivity. Type 2 hypersensitivity disorders include cytotoxic hypersensitivity, and this is where the cell membranes release, the cell membrane triggers IgM and IgG antibodies to work against itself. Type 3 is an immune complex hypersensitivity. That's where the antigen-antibody complexes are not promptly removed by the system that does remove the antigen-antibody complexes. And type 4 is delayed hypersensitivity, and that's caused by CD4 lymphocytes, not antibodies. So there's a variety of different hypersensitivity disorders, and I think we're most common with the type 1 or the immediate hypersensitivity disorder in the form of an allergic reaction or anaphylaxis. Now, an allergic reaction, the patient is, might have a little tightness in their chest, have the watery eyes, a runny nose, the itchy skin, the hives, but that's not shock. When it starts to affect the body systemically, where they can't breathe and their blood pressure starts to drop, then that's anaphylaxis, and that's where we have to step in with things like epinephrine. During anaphylaxis, the inflammatory response from the histamines and the bradykinins and leukotrienes and those other chemicals, when those are released into the bloodstream in large amounts, the vessels fully dilate, and that's what causes the shock. The vessels fully dilate, and then if the hypersensitivity reaction continues, then the capillaries begin to weep plasma into the interstitial space. They start third spacing, and that's where it becomes shock. There are some transplantation disorders that are part of the immune system pathology as well. Anytime a person gets a transplant, the potential for the body rejecting that transplant is high. And in many of these patients who receive transplants, they have to make certain that it's a good tissue match, it's a good blood match. There are similar immune responses in the tissue that's being planted as well. So the transplant disorders include human leukocyte antigens, allografting, isografting, xenografting, and autografting. And you can read more about those in your text. Patients who do have transplants take a variety of medications, anti-rejection drugs, drugs to prevent the release of histamine and bradykinins, and so antihistamines and those sort of things in order to prevent reactions. Now, your field management of somebody with an immune disorder is to do a patient assessment to determine if what they're experiencing is life-threatening. As in the case of anaphylaxis, that certainly is life-threatening. So assess their airway, assess the need for supplemental oxygen. Obviously, if they're complaining of shortness of breath, if their pulse oximetry is low, if they're making any noises when they're breathing, those certainly would be indications for the administration of supplemental oxygen. If there are no other life threats based on your ABCs, attempt to complete a secondary survey, particularly the history. because the history can give us an idea as to whether or not they have knowledge of a pre-existing immune disease like hepatitis, those sort of things. Okay. Allergic reactions are managed with antihistamines at first. Establishing an IV, the antihistamine would be Benadryl, and it can be given IV or IM. The beta agonists might be given in the form of albuterol or a breathing treatment, and the beta agonists help dilate the bronchioles so that they can breathe easier. The antihistamine stops the production of the mast cells, releasing histamine and bradykinin and leukotrienes and all those things that are causing the allergic reaction. In severe cases, the beta agonists may not open up the bronchioles so that they can breathe, and in severe cases of anaphylaxis, when their vessels fully dilate and their container starts to leak, something like epinephrine would be of benefit, because the epinephrine not only increases the rate and strength of contraction, which will help with the blood pressure, but also causes vasoconstriction to help constrict that container and keep the pressure up in the system. Glucagon is something that may be given because during an allergic reaction, glucagon helps dilate the bronchioles and has no beta effects. So it's not going to increase the heart rate. It's not going to do those other things that are associated with beta agonists. Steroids are important, but they take a long time to work, so the sooner you can give them, like prednisone or methylprednisolone, which is prednisone. Things like aminophylline may be something to consider. Things like magnesium sulfate, which help. Magnesium sulfate is a muscle relaxer, so it may help relax the bronchioles. Things like combining helium with your oxygen, or HELOX, which may help the delivery of your nebulized medications as well. As far as public health and immunity goes, the importance of our public health departments is to prevent disease and prevent acquired immune system disorders by making certain that everyone is vaccinated. The immunization recommendations for EMS include making certain that your childhood vaccinations are all up to date. If you've not had your tetanus or not had your MMRs or those sort of things, making sure that they are all up to date. Because you're in EMS and because you're around blood and body fluids, certainly the getting a hepatitis B series is important to help protect you from hepatitis B. Keep in mind, though, that about 10% of the people who take the 3-set immunization don't seroconvert. So they don't develop antibodies at all, and therefore the immunization was little of no value. Get your annual flu shot. We kind of missed the mark this year with not hitting the right types of influenza, but certainly any influenza vaccine helps you build antibodies that may still assist you in fighting off influenza if you get it. Now, when we talk about the flu shot, we're not talking about the GI flu with the vomiting and diarrhea. When we talk about influenza, we're talking about the influenza that gets into your lungs and causes pneumonia. A little over 1,000 people die every year in Iowa from influenza A or B, pneumonia acquired by those influenza. And so getting the flu shot is so vitally important to prevent that from occurring. Typically, we watch Southern America, and as the virus moves its way north, it typically starts in the south and moves its way north. The United States, based on what's occurring in South America, have an idea of the type of viruses that we'll see that cause influenza, and manufacturers of the flu shot are able then to, based on what we're seeing, develop immunizations that are effective. And some years they're spot on, hit both types. Some year they hit one, some year they don't hit either, because viruses do mutate and change as time goes on. Should make sure that you have your tetanus toxoid up to date as well. And then as far as HIV goes and public health's role, certainly the role of public health with the HIV virus is to develop mechanisms to reduce transmission, whether that be handing out condoms, educating the general public on how it is spread, and asking them to protect themselves, developing treatments. There is a certainly set of immune globulins that you may receive following a significant exposure to potentially prevent you from getting the acquired immune deficiency syndrome. So there is vaccine, there is treatment, things that you can get to assist you. There's not a vaccine or a cure for AIDS, but certainly there are prophylactic medications that you can receive following a significant exposure that may help you fight it off should you be exposed to it. All right, so we looked through the immune system and we talked about how it included both internal and external defenses to protect you against pathogens, and pathogens included prions and viruses and bacterias and parasites and fungi. We talked about how your internal defenses were divided into natural and acquired immunity. Natural immunity comes from your mother. Natural immunity comes from breastfeeding. Acquired immunity is something that you get through something like a vaccination. We looked how the immune system can fail, causing immunodeficiencies, which may be acquired as you're exposed to pathogens, or they may be congenital. You may be born with them, as in the case of MS, muscular dystrophy. We talked about congenital immunodeficiencies such as severe combined immunodeficiency syndrome are present at birth and they're not genetic, and how acquired immunodeficiencies such as HIV have to be transmitted from patient to patient, and the patient has to be infectious. We talked about how autoimmune diseases are present and how the immune system responds to attacks on its own tissue, and these were the autoimmune diseases like multiple sclerosis and type 1 diabetes. We talked about hypersensitivity disorders and how they present themselves, with us being most familiar with type 1 or immediate hypersensitivity disorders, where we see the allergic reactions and the anaphylaxis. We talked about anaphylaxis as being an example of a type 1 hypersensitivity reaction, and drug reactions are an example of type 2. So things like angioedema caused by taking a new medication for the first time would be considered a type 2. Post-streptococcal glomerular nephritis is an example of type 3, and post-streptococcal glomerular nephritis has to do with the kidneys. So some sort of nephritis with the kidneys. And then tuberculosis skin testing is an example of type 4 hypersensitivity. We talked about transplant recipients and how they can have two different types of problems involving the immune system. The immune system can work too well and reject the transplanted organ, or the immune system is suppressed, and in order to avoid rejection, they have to take anti-rejection medications to prevent that from happening. We can't stress enough the importance of meticulous attention to personal protective equipment and how standard precautions are so important when treating all patients, because we don't know whether they have a communicable immune system disorder. Many people carry the virus but never get the disease, so if we were exposed to their blood or body fluid, we may get the virus as well, seroconvert, and actually develop the disease. Meticulous attention to personal protective equipment and standard precautions include complying with all the vaccination requirements for healthcare providers. And in many places, like when you work in a hospital, there's no say in the matter. You typically are required to receive your flu shot every year unless there's a medical reason you can't receive it. And if you still continue to refuse it, many people are making you wear masks on your face through the entire flu season, so that if you do have influenza or any part of the virus, you're not spreading it to sick patients that you're caring for. All right, so with that, if you have any questions, I know the thing about all the immunities is quite confusing at times, and the book does a nice job of explaining the different types of immunities. And without our immune system, certainly we would develop opportunistic infections that normally we'd be able to fight off, that could lead to our demise. You know how to get a hold of me if you have any questions. Feel free to do so. So I'll talk to you soon.